Good evening, everyone. I'm delighted to welcome and thank all of you for joining Capital Health Network's webinar entitled Optimizing Referrals. I am Ross Trinidad, Senior Manager for Quality Improvement in CHN, and I'll be facilitating tonight's webinar. Before we start, I wish to acknowledge the traditional custodians of the land that we are meeting on, the Ngunnawal people. I wish to acknowledge and respect their continuing culture and the contribution they make to the life of this city and this region. I would also like to acknowledge and welcome other Aboriginal and Torres Strait Islander people who may be attending tonight's webinar. Some housekeeping. So all participants have been muted. Please enter your questions in the chat box or in the Q&A box, and we will answer all those questions after all the presentations. We will have a Q&A session in the end. And this presentation will be recorded and will be uploaded on CHN's YouTube channel. And the link to the recording and other resources will be sent to you following the event. So as you all know, the Australian Digital Health Agency recently released the National Digital Health Strategy. And one of the objectives of the strategy is interoperability between clinical systems and information sharing between clinicians to improve patient outcomes. So our webinar tonight supports electronic information sharing and referrals. By the end of this activity, participants will be able to understand the benefits of electronic referrals for their practice and patients, know what happens to your referral at Canberra Health Services, learn how HealthPathways can support you at the point of care and provide you with referral information, and you will also learn how to send electronic referrals to private specialists using SR Specialists and Referrals. So without further ado, I would like to introduce to you our first presenter, Dr. Anne-Marie Svoboda, to talk about electronic referrals to Canberra Health Services. Dr. Anne-Marie Svoboda is the Medical Director of Canberra Health Services GP Liaison Unit. She completed her medical degree at UNSW and obtained her FRACGP in 1996. She also has a certificate of family planning and a postgraduate diploma in forensic medicine. Her special interests are women and children's health, geriatrics, general medicine, and minor procedures. Dr. Anne-Marie Svoboda is also the Senior Medical Advisor of Fisher Family Practice, in addition to being a GP and GP Registrar Supervisor. Please all welcome Dr. Anne-Marie Svoboda.
Thank you, Russ, for that introduction. And thank you, everybody, for coming this evening. I'm really excited to do this very short presentation for you. I hope I won't be boring you too much. I know it's been a long day for everybody. Russ, can I just confirm with you that you can see my presentation and hear me okay?
I can hear you, Anne-Marie, but I think the presentation is not showing yet.
Oh, okie dokie. Glad I asked. Let me try again. Are you seeing it now, Russ?
Yes.
That's a good start. Okay.
Yeah.
Have we got it now?
All good now.
Thank you. So sorry. Okay. So I've been asked to talk today about electronic referrals to Canberra Health Services and North Canberra Hospital, and why it's important that we start to have all our GPs in the ACT and surrounding region using electronic referrals as the way to send your referrals into the system. And I acknowledge that it's really hard to change practice away from paper-based referrals. Certainly, I've been very used to using paper referrals, and I know that from my own software that it's a simple and easy way to do a referral, but there are good reasons why paper is a problem. So one of the big problems with paper is from our system end, from the Canberra Hospital end, is that fax numbers do change all the time. And unfortunately, at GP software practices, we don't always update in our own systems our practice software address book. So it's not the most up-to-date way to know where to send a referral to. You could have a fax number in your system that might be 2, 4, 10 years old and is completely out of date. And the same also goes with email addresses. So it's not a reliable way to send your referral. Paper also gets lost. So what happens when you send a fax to, somewhere else, to a fax number? Well, that might be printed off as a piece of paper and put on somebody's desk and could become lost. So it's not a very reliable way for those referrals to be sent, again, to a very big system like a major public hospital. And it also is a much harder way to track the referrals and where your referral might be up to in the system. So particularly in relation to triaging and when an appointment is made for your patient. It's not possible to do that through paper. So at Canberra Health Services, and this includes North Canberra Hospital, we will very shortly be moving to electronic only based referral system. So the expectation will be that GPs will refer into Canberra Health Services and North Canberra Hospital electronically only. I don't have an exact timeline for when that is going to happen, but you can expect in the near future that fax and email will not be an option. And at the moment, we have the option of HealthLink SmartForm referrals that GPs can utilise. SmartForm referrals through HealthLink is integrated with the main GP practice software, Genie Solutions, Medical Director, Best Practice, MedTech, and now also with Communicare. So you can access that very easily from your practice software via the HealthLink tab. For those practices that don't have those compatible software, there is a portal that you can access through HealthLink. And we are also exploring some other options for GPs through DHR HealthLink, and we hope to have another pilot happening in the near future to explore how DHR Link could be used for electronic referrals. But the current system is through HealthLink SmartForms. So from HealthLink SmartForms, it's very easy to use from your practice software. So essentially you go into the HealthLink tab, you select for a new form, and what you'll be looking for is the ACT Public Outpatient Community form. Once you've clicked on that form, you then are able to select from a drop-down box a list of specialty services. So it might be gastroenterology or cardiology. If you click cardiology, then you can select which hospital you would like that person to be seen at, whether it's Canberra Hospital or North Canberra Hospital. And you can select a specialist from the drop-down list, or the head of service, or a not to a named specialist referral if that's your preference. It is at present a very generic form, so it doesn't have service-specific information, and we don't have any specific requirements that you need to put in the referral. However, there are mandatory fields that do need to be completed in the smart form, and of course you should be attaching all of the relevant information for a referral to be accepted. And that includes all of the investigations that you have done so far, any radiology or other letters that you wish to attach to that referral. Whilst we don't have yet service-specific smart forms, it is really important that GPs understand that the quality of the information that they put in the referral really does impact on how a referral is going to be triaged within the service. So if there's minimal information, then it makes it very hard for the triaging clinician to be able to accept that referral. The more detail that's put in, the more information, and the more information about what management the GP has already completed, the more likely the referral is to be accepted by the service. Once you've sent a smart form referral into the system, it's automatically saved into your practice software, and you receive an instant acknowledgement back, which confirms that your referral has been received and it's time-stamped. Once it passes through the system, it comes into what we call central health intake. And from central health intake, there are several things that may happen to your referral. It may be sent on directly to the specialty to triage, and the specialist will have a look at it and triage it. Or it may actually be dealt with at CHI and reviewed by the nursing staff at CHI and checked for accuracy and completeness before it is then sent on to the triaging clinician. And that does mean that sometimes referrals will be rejected from the CHI entry point if there hasn't been all of the information required for completeness of that referral. Once your referral is accepted into the system, then the GP will receive updates back into their software through HealthLink. And those acknowledgements will confirm acceptance of the referral. And when that referral has been triaged, you'll receive a notification about what category your referral has been triaged at, and when it's been waitlisted for an appointment as well. So these are our contact details at GP Liaison. So you have GP Liaison unit at Canberra Health Services and also North Canberra Hospital, GP Liaison. So contact either of those units if you have any issues. You can also contact Central Health Intake to discuss any referrals that you have sent into the system. And if you're having any difficulties, technical difficulties with the HealthLink SmartForm, then the HealthLink help desk is who you need to contact. So that's all I had to talk about tonight, and thank you for listening. And this is our new clinical services building, which is opening very shortly. Some of you will have seen it. It's opening in August, so just a few weeks' time. And we'll be taking questions at the end, I believe. Thanks, Russ.
Thank you, Dr. Anne-Marie. Thank you for discussing the challenges of paper referrals and for discussing what's the process, what happens when a referral is sent to CHS. And I think very important to notice what you've shared today about electronic referrals being mandated, and fax and email will not be an option in the near future. Yeah. So thank you for that information, Dr. Anne-Marie. I can see there are questions coming. We will attend to them after all the presentations. So our next presenter is from SR Specialists and Referrals. Eric Dunn is the GP liaison at SR Specialists and Referrals. With more than 25 years in the technology industry, Eric has worked in diverse areas of information technology, from document management to manufacturing, online marketing, and digital security, with the last 9 years focused on digital health. As the Digital Health Manager at Sydney North Primary Health Network, Eric led digital health projects for specialists in aged care, funded by the Australian Digital Health Agency, as well as a number of digital health programs, including regional expansion for My Health Record, secure messaging, delivery, and telehealth. He also led the development and delivery of the Sydney North Digital Health Strategy. Eric is a qualified change management practitioner interested in people-centered proactive solutions and advancing digital maturity in the wider health landscape. Eric is currently working with SR Specialists and Referrals, implementing the expansion of e-referrals between GPs and private specialists across the country. Let us all please welcome Eric Dunn.
Thank you, Russell. I'll just share my screen as that comes through.
Yes, thanks,
thank
Eric.
you. So I'll just get straight into it. So tonight I'm going to be talking about electronic referrals for general practice, to sending electronic referrals to private specialists using the HealthLink SmartForms. Servan Media are the publishers of the very well-known medical specialist directories, and we have collaborated with HealthLink to provide an end-to-end solution for referrals called SR, Specialists and Referrals. The medical specialist directory is now integrated into your practice software and linked to the HealthLink SmartForms, so you can securely and seamlessly allow for referrals to private specialists. And I can see from our statistics here that clearly a lot of GPs in the ACT region are using specialists and referrals for sending referrals to private specialists. It has been increasing usage steadily over the last 4 years. And as you can see on this chart, the red bars are this year. So good job, great work. But for those who don't know, I'll quickly show you where SR is in Best Practice and Medical Director, and then we'll have a look at what happens when a specialist receives an SR e-referral through HealthLink. So I'm going to go straight on to a demonstration. So this is, first I'm going to start with best practice. So this is a patient file or test patient file in best practice, and which you're probably quite familiar with. And at the top here, there's the HealthLink button. This is a live system. And I click on the HealthLink button, and that brings up the standard HealthLink Forms browser. Now, the number of referral services you get on this page will depend on where you are geographically. But at the top here, you can see the ACT Public Outpatient and Community link that was referred to earlier. But also just above it here are specialists and referrals. So down here is where you get the public system, and up here, the private system. One of the great things about using specialists and referrals for referring to private specialists is that you don't have to maintain an address book. So you don't have to worry about whether the fax number is correct, whether the specialist has moved, because we keep this directory up to date daily. When you click on this button, instead of taking you to a SmartForm, it takes you to the directory. And here we have the directory, and I'm not going to go through the SmartForm in detail, but what I will show you is a couple of things here. First of all, once you're here, if you forget what to do, we have quick start guides. So you just click on these and you can download a guide on how to do this in your software. There is also a quick little video here. I think it's about 1.5 minutes that you can watch. And more importantly, at the bottom are our contact details. So you can call us for support, or you can send an email and we'll provide you with some help. There's also the recently profiled specialist, but I'll just click on one of these to show you something. When you look at a specialist through this system, you can see their profile. You can, this is a frequently used specialist, you can add them to your frequently used, but you can also email the information about the specialist to your patient. When you click on this, it brings up an email profile to patient box. You put the patient's email address in there, and then you just send it. Once you've sent it, then this is what the patient receives, which is an email saying that your GP has sent you the profile and contact details of this specialist, and it's available on Oz Health Pages. When they click that link, or this one, it brings up the specialist profile in Oz Health Pages. And Oz Health Pages is a public-facing directory of specialists, and it's basically the same directory that you see. But in here, then the patient can click on the phone number and ring the specialist. They can also see all of the information about the specialist. And you can, if you want, you can send multiple specialist details to the patient. This is the home page of Oz Health Pages, and you can also use that if you like to search for specialists if you don't have your software available. Going back here in the main search, you can search by specialist name. If you know their name, you can select a category. You can search by suburb or telehealth, or put in a keyword. And down the left side here, you can see there are my frequently used, my recent searches, and my recently viewed profiles. Once you have found your specialist, then you can send them via a SmartForm. We have a test specialist in here that you can practice with called Dr. Earlobe. And once you have, you can send as many test referrals to Dr. Earlobe as you like, but please don't send us live patient data. And you just pick an address, and then it brings up the standard SmartForm, which is then automatically populated from your patient data in your software. It always runs very slowly in a presentation. Come on. Okay, I won't wait for that. I'll come back to it. I wanted to quickly also show you what that looked like in Medical Director. So this is Medical Director, patient file. I'll just log in to this one and show you where that is. So this is a patient file. I'm in the progress notes. On the far right here is the HealthLink tab. You just click on the HealthLink tab and then go New Form, and it brings up the same browser. So once again, that is not working. So that should bring up the standard browser. Oh, I will come back to that. And it will look exactly the same as it does in the other software when it's working. And I also have Genie. So this is Genie. And what I wanted to show you here, first of all, if you open a patient file, so if you open a patient file and do the same thing, looks like I'm having IT issues, patients. And if I open a patient file, okay, well, while I'm waiting for that, what I will do is I'll show you what happens when you receive when a specialist receives a letter, a referral. So that will be in the incoming letters. And here I have a bunch of letters that have been received by this practice. So I'm not in a patient file. I can see here that I have a whole bunch. And if I double click one, these are the unlinked ones. If I double click one, I can see here is the letter that's been received. So it's a referral to Dr. Earlobe. It was sent by ZMed, and it's for this particular patient. There's the patient data. And up on the left here, I have 3 red X's, and that, or not equal signs, that shows that I don't have this patient in my system. So it's very easy for me to create a patient. I just click on the new button, and that will then automatically populate the patient file with the data from the referral. And then I go save. And once I've done that, I now get 3 green equal signs, and now I can link this referral to that patient. So that makes it very easy for a specialist to create a patient file from the file that you have sent them. When I close that, I can then go through and do the next one, and I get the same thing again. And you can see here that this one, I can have a look at all of the information that's come through on this patient. It's all in one PDF, but I don't have them as a patient, so I can just then create them a new patient and then link this file to them. The other thing I quickly wanted to show you was the HealthLink portal. So this is the HealthLink portal. So if a specialist does not have conformant software, then they can use the HealthLink portal. So I'll just log into that. And here, this is the portal. You can see that I've received a number of referrals in here. Same thing, I'll just open that, and it's a PDF file and it has all of the information in it on that patient. But then I will have to download it and print it, or send it via whatever process the practice uses to get to the specialist. But if I'm a GP who's using this, then I can compose a new message, and I get exactly the same HealthLink SmartForms. So here you can see these are all the referral services, and above that is Specialists and Referrals. And that takes me to exactly the same browser. And then I can find the specialist. I can do the same thing. I can send the information to the patient. The only difference here is because I don't have a patient management system in the back end, I have to fill in all of the details manually. And then just going back to my presentation. So we provide extensive free training, and we're happy to contact specialists that you refer to so they can use SR as well. Whatever their workflow is, we can help them integrate SR so you can both reap the benefits of electronic referrals. And our sole purpose is to help GPs and specialists. We've been doing it for over 30 years. We're sensitive to your requirements and admin processes, and we're sure our tools will make your life easier. Feel free to call us or email us with queries or for training. And as I said, let us know if you've got a particular specialist practice that you would like to see shift from faxes to e-referrals. We can contact them for you and offer to set up and give them support and training. And then I'm open to questions after this. Thank you.
Thank you, Eric. Thanks for showing us how easy it is to use a SmartForms, and that there are two options, either through the practice management software or via the portal. It's also good to note that ACT is leading electronic referrals. So thank you. From CHN, we know that there are 60% of general practices using electronic referrals, but we would like more GPs to use e-referrals. So thanks again, Eric. Last but not the least, we have Dr. Louise Kenyon to talk about HealthPathways and her experience about e-referrals. Louise has a number of roles. She works as a GP and as the HealthPathways clinical lead for the ACT and Southern New South Wales program. She also conducts clinical training visits and examines registrars for the RACGP. So please welcome Dr. Louise Kenyon. Thank you.
Thanks, Russ. Hello. As Russ just said, I'm the clinical lead for the ACT section of the HealthPathways program. We're funded by both the ACT and New South Wales government from the local hospitals and the two PHNs for those regions. The reason why we cover both PHNs is that Southern New South Wales tends to refer to Canberra for its tertiary services. HealthPathways, I hope everyone's used, but it's tagline is trusted information at point of care. It's evidence-based and locally relevant. And I think that's a really important differentiator of our resource to other resources. So say e-therapeutic guidelines is a national guideline, and it's terrific for management, but when it says refer, it'll say refer to specialist. And quite often it doesn't even say what kind of specialist or how, obviously not how to contact them. HealthPathways goes all the way from assessment through management and then referral. We've got 3 types of pathways: clinical, referral, and resource. To access HealthPathways, and please feel free to pick up your device and log in. It's you can just Google HealthPathways ACT, or there is the website. It's for all APRA registered health professionals. However, the main focus is GPs. That's the audience we're writing to. The username is together and the password's for health. You can also, if you've got to the page and can't remember the username and password, there's a link to say, please give me a password. The reason why we are here in this session for referrals is that each of our different pages can help with your referrals. So first of all, the best referral is a referral you don't need to write at all. Our clinical pages help GPs to work at the top of their scope. Also, the clinical pages have information so that you can help get the patient to the right person at the right time with the right information, which is the relevant history, examination, findings, and investigations. That links back to what Anne-Marie said, that to have your referral accurately triaged, it's really, really important to have the right information. I kind of think of it a bit like the secret handshake that gets you into the service. If you can give the information in the way that the triage nurse is looking for it, it just helps that referral get through the system faster. So here's an example of a clinical page. This is dementia and cognitive impairment. What you'll see is a number of features. When there's blue writing without any arrows, it takes you off to a different page. When there's blue writing with a downwards arrow, it takes you to, it opens a drop box. This helps to make HealthPathways just a bit more user-friendly and cater towards lots of different audiences. You may, for instance, really know like the back of your hand what the 5 domains of dementia are, or you may never have heard of that. So it just helps to clarify what we're talking about. The other type of link we have is this link here, where we have the box and the arrow out. That links to an external resource. So as I said, we then have referral sections, and you can see in the referral section, there's lots of blue with no arrow, which means that if I click on the consider referring to dementia support, I will open up a page that has lots of information about the dementia support services that are available. The referral pages list the available resources. They're sorted by region and then public and private. The public services contain the contact details, the required information, the exclusion criteria, and the triage categories. The private services have the subspecialties of those specialists and their contact details. There's also capacity to add more information, but often it's not provided. So here's an example on the left-hand side of the screen of the geriatric medicine referrals for the ACT and public. And then on the right-hand side of the screen, you get the information of what's provided when you open up one of these boxes. So the telephone number and fax number and the pre-requirements for referral, that secret handshake. We also have GP colleague referrals. This is just a list of the different categories. Within these, it's just acknowledging that as GPs, we're a jack of all trades and master of none, but each of us has usually got a subspecialty, and this is about how to have other GPs find you with your subspecialty. So here I've opened up men's health, and there's circumcision for obviously men. In where I've got the big green arrow, you select a practitioner. That opens up to a list of the practitioners that are offering that service. If you wish to be included in the GP colleague referral pages, there's your other green arrow. You link off to a form that collects information and populates the page. We also have resource pages, and these are the how-to pages for our health system. So if perhaps you haven't already linked up to HealthLink, or you would like to know how to, then we have a page that teaches you how to use eHealth referrals. As always, HealthPathways is a growing resource, and it's a responsive resource. Every single page has this send feedback button. We really actually do like feedback. A lot of people think, oh, well, it's not a big issue, or don't think it's going to be important. But we really do like the feedback. It helps to prioritize. It helps to quickly fix mistakes if you see them. And your expertise really, really does help us keep the resource up to date. So you can use the send feedback button, or you can email us at healthpathways@chnact.org.au. Just a reminder again, the username is together and the password's for health, and you can email us on healthpathways@chnact.org.au if you have any questions, comments or feedback. Thank you very much.
Thank you, Louise. I guess that's a very helpful information. So just a reminder what HealthPathways has. It has important clinical and referral information, GP colleague referrals, and other health system information. Before we move to the question and answer session, I would also like to share with everyone that the HealthPathways team also developed the Dementia Services Guide for patients and carers. So it includes information about after-hours providers, care coordination services, counseling and helplines, transport services, legal and financial assistance, and many more. So we'll share the link to these resources. You can send the link to your patients or print some out in your practice. And we'll share all these in the post-event email. So please remember, if you've got any questions, please send them through the chat. And I encourage all the speakers to turn on their cameras so that we can answer all the questions posted. Thank you. So the first one is from Tracy. Is the problem with iMed attachments going to be fixed? And then Dr. Anne-Marie is just wanting some clarification about the problem with iMed attachments, Tracy. If you can please provide that to us. The next question is there any planned workaround or upgrade for the character limit on HealthLink referrals?
Not that I'm aware of, Russ. I know that it is an issue for GPs, that there's a character limit in the reason for referral section of the SmartForm. You can get around that by doing a copy and paste from your notes in your practice software. So from your electronic medical record, you can copy what it is that you were wanting to say and actually put that in the reason, and that allows you a little bit more. Otherwise, you can put an attachment with further information if that was necessary would be the other workaround that I can think of. But there is a word limit. I've never found it to be a problem. I've always found that I've got more than adequate space in that box for all the information that I want to put in a referral. But I'd be interested to know what Louise thinks, if she's found it to be a problem.
No, I sometimes have a problem with the types of things that I can attach and working out which ones. You know how you get the radiology in the two different formats, and then when you go to attach a document, it's not, you know, it's
you've
not
got to
always
pick the right format.
Take and which one it won't. But no, I don't write that much.
No.
I guess well, it might happen if I can't. Sometimes what I try and do if I haven't been able to attach something is I'll kind of cut and paste from that document. And maybe if I was doing that, then I would exceed the word limit.
I mean, I think, and Eric might know specifically about the issue that Tracy raised with the radiology report, but I've not had a problem with it. I think it is how you receive sometimes the report within your own practice software, and you need to pick the right attachment, as Louise was just saying. So it is quite extensive what you can put in as an attachment. You can put JPEG, Microsoft Word, PDF documents, RTF, which is, I think, how we receive our IMED reports, and TIFF documents.
I can show you something in there now in a form. So when you, this is the standard, if you like, the basic form. And when you go to the attachment report section, there's a list at the top here. Attached file from EMR, the supports docx, GIFs, and so on and so on. And you need to keep to that, otherwise it won't work. I haven't actually come across, it used to be a lot of problem with the reason for patient referral size, but I haven't heard it for a while, like a couple of years now. So it could be that they've increased it on these forms, but the newer forms, they've forgotten to do it. So maybe put in a request to HealthLink about that. You know, because you've developed your own forms, you should be able to get them to increase that.
Thanks, Eric.
Does that help?
Thanks.
I'll stop sharing.
Thanks, Anne-Marie and Louise. Tracy sent a follow-up message saying it is about the two different formats of reports from IMED.
Yeah, so I think IMED does fax one report and then sends an RTF report. So you've got to choose the RTF report.
Thanks. Our next question. I have been using SmartForms with great success. Thanks, that's good to know. I've been only using the electronic referrals for many months now. I can't attach any imaging reports, however. Is it a software problem? CT or X-ray reports not getting uploaded?
So it's kind of the same issue. When you are attaching a report, it needs to be, can I just show you again in this form? Share. I have an X-ray that's in the software, so I can select that. So if I've saved it into best practice, then it's very easy for me to select it here as part of the attachments. But also if I browse for a local file, I can choose a file that's on my system. But once again, it needs to be, so I often, as a example, attach X-rays, and they seem to attach right, but they need to be JPEGs or WebP, or actually I don't think a WebP will work. But and it's not particularly difficult. If you ask your IT people, they should be able to convert your non-attachable files to attachable ones. You know, it's very easy to convert a WebP into a JPEG. And so they should be able to set up a batch system so that it just automatically converts them all for you.
Thanks, Eric. And I think in the previous webinars that we had around SmartForms, one thing as well with the X-ray reports or images is because of the limitation in the file size. I think it's 7 MB is the limit, but you've said, Eric, has that been increased? But that can probably be the issue why it's not attaching.
It could be, yeah. If you've got a very large file, so a lot of X-rays can be enormous files. So yeah, you'd need to convert them to a smaller size.
Yep.
I think it's around about 7 meg.
Yep, thank you. From Tracy, it seems that even if we have spoken to our registrar about a semi-urgent matter and they ask me to send a referral, it takes a long time to be triaged and allocated an appointment.
What can I say, Tracy? I mean, I think it depends on the situation, what's going to happen with that. So it's always helpful if you put on the referral that you have spoken to a specific registrar and the name of that registrar. That will help your referral be progressed properly. We can't control what somebody is doing at the other end if they've forgotten about a particular situation. So if you are having difficulties, I think, and there's a specific situation, it would be best to also, and you haven't heard anything, contact GP Liaison, and we can then assist to find out what's happening and escalate that to the registrar or to the consultant if necessary. I hope that that doesn't happen too often, but if it does happen, please let us know.
One thing that the private system has is it has the ability to say urgent on the form. It'd be nice if the public had that. I guess it would depend on GPs not abusing it, but it'd be good if we could also have a marker in the system.
Next question. I have a patient who comes from Queanbeyan. How can I refer to Queanbeyan Hospital, for example, Allied Health Service? This is...
So
I'm not
Queanbeyan
sure
is
about...
part of New South Wales, Russ. So
yes,
it's not part of ACT
DHR.
Health. Yeah.
What I know about that is currently NSW PHNs and local health districts are scoping and looking for electronic referral platforms. They are actually looking at ACT because of how we implemented HealthLink SmartForms successfully here in ACT. But this is a space that's still unknown at the moment. But if we have further information, we can share it through our CHN newsletter.
Russ, do you mind if I jump in for a minute here?
Yes, no worries, Michaela.
I'm sorry,
Thank
my
you.
video is not working super well. Hi, everyone. I'm Michaela from Capital Health Network, but I also work as a physio for Canberra Health Services. And Southern New South Wales are still using a paper referral form for Allied Health Services. So it's a generic one similar to the old CHI referral forms, and it can be completed and emailed to them. So Russ, if I pass those details on to you, are you happy to send those resources out?
Yes, no worries. Thanks, Michaela. That's
and
very handy.
all things being equal, you should be able to go to physiotherapy referrals, New South Wales, and find the details there on how to refer to those services and what services are available.
Thanks, Louise. I think we've got the last question here. I have now been using the e-referral to the emergency department in case I had to send a patient after hours, like urgent results discussed over the phone. It just works brilliantly. Also for my geriatric patients in nursing homes getting appointments for, let's say, stomach clinic or dermatology clinic. What can I do if I don't receive any response back from my electronic referral?
So you should be receiving a response back if you have sent an electronic referral to let you know that it has been accepted or not accepted. If you haven't received a response, that is a problem that we would want to know about, because there might be an issue with how that's been processed through CHI. So again, if you had a specific example about that, I'd be interested in hearing from you at GP Liaison so we can trace back and see what exactly has happened in that process, because it shouldn't happen. It may, of course, take time for your patient to receive an appointment, depending on the urgency of the referral, but you should, if it's electronic, receive notification when it is triaged.
Thank you, Anne-Marie. I think, are there any more questions? I'll give it a few minutes, few seconds, I mean. All right, so if there's no more question, thank you once again, everyone. Thank you to all our speakers, our CHN events team and QI team as well, and to all of you who joined us in tonight's webinar. We will send out an email which will contain the webinar's recording and other useful resources related to today's topics. Please remember, if you have any question or feedback, please feel free to send an email to CHN's primary care team at primarycare@chnact.org.au. So thank you, everybody, and have a good night.